So for specifically state employees and teachers, what we have allowed is that the self-test can take the place of the PCR test, specifically related to those who are unvaccinated who might be coming back to work. So that is what's in place right now to be able to relieve some of that pressure on people who are needing tests because of the pressure both on PCR testing and for self-tests. Also, in addition, our school guidance has changed where we allow for self-tests in addition, not just PCR tests.
These tests aren't they're gonna say that you've got the virus. They're not gonna say, well, you're not gonna know whether you had Delta or whether you got Omicron, anything of that.
Right. Yeah. So first of all, in general, when you do a PCR test, in terms of our laboratory partners across the state, about 25% of PCR tests are sequenced to know whether it's Delta or Omicron, and that is not going to go to the individual patient. It gives us a sense of the different types of variants that are circulating across our state. And so we get a sense of where things are moving. This is how we saw Delta take over in terms of the entire state, and how Omicron is continuing to rise, and I predict will be the entire state very soon. So PCR tests are able to give us that information. Self-tests, because they are, one, not reported, and secondly, we don't perform that kind of sequencing, they do not serve that purpose. However, they serve a very important purpose of people keeping and staying home when they realize they're infected.
I think last Thursday's extended report, was it about 22%?
Yes.
The tests came back home.
That's correct. So we will have more information this week when we get all our results from various different lab partners. What I can tell you is that in our state lab, Omicron was identified in all of our counties throughout our state. So it may be in different proportions. I would suspect that Fairfield County has the majority, but it is everywhere in the state and will continue to move in that direction.
Doctor, the reportable test, roughly what's the breakdown between PCRs and rapid?
So to be clear, rapid tests are not reported to DPH at all.
Oh, really?
Yes.
Even
So
even if you're in a clinic?
No, so in a clinic, if it's an antigen test in a clinic, that is different than a self-test that is done at home.
I'm not asking about self-test.
Okay.
I'm talking about people who go to a walk-in or some other facility and get a rapid test versus a PCR. Just roughly what's the breakdown of identifying the reportable test?
Between the antigen tests and the PCR tests. I don't, unfortunately, think I have that number top of head.
When do you think you'll start to see hospitalizations
Well, I'm very concerned. I'm very concerned about our hospital staff. I'm concerned about nurses and doctors that have been working on the front lines. As we've heard what's happening in New York and New Jersey, we've seen throughout this pandemic that generally what happens there eventually makes its way to us, which is why we really need people to do the things they know they can do right now. And those mitigation measures of wearing your mask, staying home as much as possible. If you are able to telework, I think that's a good thing to do right now, because I am concerned if we're going to reach those same levels. I think it's not clear exactly when those hospitalizations will flatten out. We do not see a flattening that I've seen as of yet. So I will be watching that very, very carefully.
What steps can the state take to ease the strain on hospital staff if hospitalizations continue to rise?
I'm sorry, could you repeat? I couldn't hear the...
What steps can the state take to ease the strain on hospital staff if those numbers continue to rise?
So we'll have to continue working with our hospital partners because there are a number of things that can be done at each individual hospital. So for example, if telemedicine type services are utilized, okay, as an example. Different things that can be done to consolidate services and be able to really optimize the care of patients that are in the hospital. And those are conversations that we have regularly with the CEOs throughout the state. And we're going to have to watch this very, very carefully because different hospitals are going to be experiencing pressures potentially at different times. And the story at one hospital may not be exactly the same story at another hospital. But that's just a few examples of the way that we're going to have to continue to monitor things. I'm sorry, I couldn't hear that completely. Positivity rate? Yeah, 21.5% is where we are in terms of PCR positivity rate in the state right now.
Should there be a statewide mask mandate at this point?
Governor, would you want to answer that?
Sure.
I don't think so. I think overwhelmingly people in Connecticut are doing the right thing. They're wearing the mask. I don't want to put a lot of counter pressures on and rebellion and people fighting back against it. I encourage everybody, wear the mask when you're indoors. I'm getting N95 masks available to anybody, so no questions asked. I think we're on the right track right now. Thanks, everybody.